Our belief is that actually you asked about the future of quality, it lies in our workforce. So we have to think about the future of our workforce. Now, we may come from different systems around the world, but we do share the same challenges and the same opportunities. So whenever we talk about workforce, we talk about shortages. We talk about having the right people with the right skills, the right time, in the right place, doing the right thing. We talk about burnout. We talk about morale. We talk about retention. And I could go on, but we have really common challenges. But we also know what the magic is that our workforce brings, and that's what we can collectively harness. Now, the WHO predicted that by 2030 there will be a 10 million shortage of healthcare workforce across the world. It's all of our problem. It is all of our challenge. It is not happening somewhere else that the rest of us don't have to think about. So collectively, we have to think about that. Now, in our system in England, we last year produced our first ever long-term workforce plan in the 75-year history of the NHS, which was a start. It's been kicked around and it's been applauded and it's been criticised, but it's a really important step to actually outline the fact that we do need to think about our workforce in the short, medium and long term. And we could have a discussion about what we mean when we talk short, medium and long term. But I'm really interested in the long term. And I'm talking 15 years and beyond. And so in that, I think what we felt was really important was that we kept up with what healthcare was going to look like in the future. And having that integrated planning between workforce and service planning was really critical. And we looked at three buckets, if you like. Training. So training has to be future focused, thinking about it in the future. Retention, and that includes a whole load of things about practical things like contracts, flexible working, staff well-being, engagement, all of those things. And really importantly, reform. And reform is huge, and reform is a challenge where how bold do we want to be? Are we going to tinker around the edges, or are we going to go large on reform? And I think that's a debate we're having in England, and we probably will need to have it across the world. So I just want to say that our future is our workforce. There are many of us in this room, I hope I can convince you, that whilst you are in the here and now, managing your own systems and the pressures that you have day to day, whether it's this winter, whether it's your financial pressures, whether it's waiting lists or coping with demand, you have a responsibility for the 15 years. I won't be around to be in my job in 15 years' time, but I will be an 86-year-old woman with a chronic condition. I will want to be looked after in a way that I know I want to be looked after. I will be at home. I will have a team of individuals that look very different from the people we have right now. And when I die, I want to die at home. And that's not too much to ask. And that so depends on the workforce that we have in that future. And that means that we have only got 15 years to think about that. I've only got 15 years to think about what kind of care I'm going to receive in that point. So when we talk about this, I'd like to leave you with three key messages. One is that we move from forecast to foresight, and we maybe can explore what that means when we think about workforce planning, and that's for all of us to think about in our own systems and beyond, whatever our role is. And in doing that, we move into the space where we think about more and different. So we need more doctors, more physicians, more surgeons, more obstetricians, but they will work differently. I think it connects to the AI conversation we were having earlier. They will work very differently. But we will also have more of different roles that don't exist right now. And that is, I fundamentally believe that, because we have roles now that didn't exist 5, 10, 15 years ago. So more and different. Secondly, we will be definitely looking at skills over roles. So for those of us who hold on to our professional domains, it's quite hard to let go of, but we need to feel less fearful of that and be quite excited by the opportunity that skills over roles brings us, and that's in the reform space. And finally, I think it's really important to understand how societal attitudes towards healthcare are changing, and how our colleagues and our staff's attitude to work is changing. And when we did our work for the plan, people who are our future workforce are telling us, we are working to live, not live to work. That's a good thing if it connects to the burnout conversation. And so we need to think about that. And in the context of healthcare becoming more of a commodity, and I don't mean that in a financial sense, I mean how society expectations of healthcare. And for us in England, it's quite a shift, moving away from a very paternalistic approach to delivering care to one where the power shift between the patient and the caregiver and the system is changing at the moment. So we have to move with that, with those times. So it's a really exciting opportunity, a window that we have collectively. So I'm here to appeal that all of us spend some of our leadership capacity and capability in the space of long-term workforce planning.